working with the community development programs, and at the same time leverage procurement, all the legal issues, all the environmental issues that are in existence. When the PMI started, we had 0 startup costs. As we expanded from 3 to 8 to 15 countries, we had to buy some or pay for some extra billets, positions, in order to continue with the scale up. But our startup costs as a separate initiative were virtually neutral, 0. So we took the virtual resources out of CDC and USAID, brought them together, and we have a pretty nifty team. We're actually able to scale up and move into 15 countries in 2 years very, very quickly. Let me just talk about what we've done. We have certain targets, not only the coverage targets, but to use known proven interventions, 2 on the prevention side, 2 on the treatment side. We have a goal of covering with those interventions 80 to 85% of the most vulnerable population groups, kids under 5 and pregnant women who are the most vulnerable to the parasite. There's a public health line, I guess. It's kind of a tipping point that if you achieve those coverage rates, you can accelerate the drop in morbidity and mortality. So those are the targeted groups and the targeted percentage in terms of distribution of commodities. As we have scaled up, in 2 years, we've touched over 25 million people, sprayed over 17 million, we've sprayed homes and benefited 17 million people. 30,000 healthcare workers have been trained, over 4,000 spray teams, all indigenous, all complementing the country requirements, and looking at other ways that we can integrate with the pharmaceutical systems, plussing up those programs, as well as the supply chain management system. So it's complementing the country plans. That is the key entry point for us, is to go in and work off the national plans and to become a partner, not the partner, with our host government. We've met all our coverage targets. You might be saying, well, what's the impact? So what? The information that's coming back from the field is quite encouraging. The president of Rwanda stood up at UNGA several months ago and said that they've seen a drop in morbidity and mortality by 62%. The Minister of Health said 50%. Now I have to be really honest here. This is not just PMI resources, but by coming in and working off the national plan, we have the other major funder, Global Fund, that's bringing in commodities and other financing mechanisms to actually do a significant amount and take credit for many of those positive signs that we're seeing. In Malawi, after distributing nets in 2 of the districts, we've seen a drop in severe anemia of 46% among kids between 6 and 30 months. When I asked a lady whose house was sprayed in Senegal whether or not this was a good deal or not, she said, yes, I'm asking that my house be sprayed again this year. Last year, before we sprayed, all 4 of her kids had malaria. This year, after the spraying, she said none of her kids had malaria. In Zanzibar, again, because of the Global Fund funding of nets and then the complementary funding of U.S. government spraying and additional nets, and then some case management work, the figures that we're seeing is that 33% of the kids that went into a clinic with a fever and that checked positive for malaria has dropped to under 1%. That's a pretty significant drop. The Minister of Health in Zanzibar was saying the blood bank now is drawing 50% less blood because of the drop in severe anemia. These kinds of cases go on and on. But again, let me try to answer the why malaria question, and then I'll wrap this up. Return on investment. Why is malaria a cause that we need to focus on and continue to embrace? Because it is the foundation. If we don't lick malaria, It's going to affect education, it's going to affect economic development, it's going to affect community development. Let me give you an example. Ashanti Gold, Western Ghana, for $1.5 million investment over 2 years, they saw a drop in the malaria infection rate of 74%. That's cool. They spent $360,000 less for anti-malarial drugs. That's less money into drugs, more money into something else. But here's the clincher. The lost workdays went from 983 to 304. That meant more men and women were at work. That meant less money, less people sick, going into anti-malaria drugs and less sickness, and more people and the community actually being able to thrive, being more stable. That's why malaria is the investment we need to continue to focus on. The Hyde-Lantos bill has recognized and institutionalized what we've done in the last 2 years, and I'm really encouraged that they've authorized, not yet appropriated, but they've authorized a significant increase in funding, because it's recognized that malaria not only is a significant disease, but they recognize it as a strong component of our U.S. foreign policy in the health sector. So looking forward, there are a number of issues to deal with: drug safety, drug quality, resistance of parasites and mosquitoes to some of our best commodities and work. We can talk about that on another day, but looking forward in this very tentative, fragile environment that we're in, with the economic situation so tentative, I think we've got to do a couple things. We've got to stay focused on what it is we're doing. We've got to look at the goal, stay focused, use known commodities, known proven interventions, because they work. Resist the temptation of embracing new schemes, any workarounds that might take us off target. And more importantly, look at the partnerships that are out there with the Gates Foundation, with the Global Fund, with the World Bank, with the private sector, with the business sector, and continue to leverage those in ways that we have never done before, because we're going to have to do that. The U.S. government cannot alone make the progress needed in order to turn the tide on malaria. So why us? Let's underline us. It's all of the people that are represented by those at the table this morning working together on behalf of the countries to do something about malaria. I look forward to your questions in a little bit.